Hi, my name is Sasha, and I'm doing a systematic review on the effectiveness of conservative treatment for lumbosacral radicular syndrome. Um, the clinical question, since people with lumbosacral radicular syndrome are usually treated conservatively, what is the best and most effective conservative treatment for sciatica? The purpose, and this came directly from the study, the aim of this systematic review is to assess the effectiveness of conservative treatments in the lumbosacral radicular syndrome when compared to placebo, inactive, or no treatment, and other forms of conservative care or surgery. So they were really looking at the differences between different kinds of treatments, and I'll get into that a little later, compared to no treatment or surgery. So the methodology, they had two reviewers independently looking at each individual randomized control trial that was involved with the study. And if there were any disagreements, there was a third reviewer who acted as arbitrator for the to determine if the randomized control trial fit criteria to be included or not. And so they started out with just searching for keywords and titles and abstracts for qualified randomized control trials. From there, they looked at the full text and see if they fit the criteria for design and subjects and interventions. Then they moved on to using the Delphi system to determine the methodological quality. And finally, they looked at clinical relevance using the Cochrane recommendations. And finally, they extracted data from the randomized control trials to be used in the systematic review. So this is the flowchart from the article, kind of looking at the same thing as I just mentioned. They started out with 794 different articles, and they narrowed it down to the final 30 that were included into the systematic review. The pros versus cons. I'm going to start with the cons. The inclusion criteria was not perfectly clear in the sense that there were several times where they needed the arbitrator to determine whether a study should be included or not in the systematic review. There was also a large breadth of kinds of conservative treatments, which means there was no depth in looking at comparisons between randomized or between conservative treatments, and there was no combining of conservative treatments for treating sciatica, so that it was either treatment or no treatment and no like combinations. So that's definitely a con. However, the pros, only randomized control trials were involved with the systematic review. They used multiple languages, so that made it a larger variety as well. They looked at several time frames of lumbosacral radicular syndrome, so acute, subacute, or chronic. They looked at all kinds of interventions, including medications, injections, physical therapy, manipulations, bed rest, traction, and acupuncture. So there was a large number of different kinds of treatments to be looked at. Multiple outcomes were used to observe any changes. There was also a lot of treatment, post-treatment assessments at 3 months, 3 to 12 months, and more than 12 months. So there was a lot of follow-up involved with this study or the systematic review. And then multiple databases were consulted to find as many randomized control trials as possible. As far as the AMSTAR tool for systematic review, an 11-item tool to determine the methodological quality of a systematic review. For this particular study, there was an 8 out of 10, or 8 out of 11, excuse me, were yeses. And so a score of 8 or higher is considered high quality, while 4 to 7 is a moderate, and below 3 is considered a poor study. So this, to me, was a fairly decent study. Was a priority design involved or provided? And the answer was yes. The research question and the inclusion criteria was determined prior to starting to look for randomized control trials. Was there duplicate study selection and data extraction? Yes. Each study was included or excluded from the systematic review by 2 independent reviewers. So each study got looked at twice. And then there was also a 3rd reviewer to help with any disagreements. So to really double check if they fit the criteria or not. Was a comprehensive literature search performed? Yes. The researchers used multiple databases, including PubMed or Medline, Embase, Cochrane Center for Registered Controlled Trials, Sinhal, PsycInfo, and Pedro. So lots of different database searches. Was the status of publication used as an inclusion criteria? Yes. Authors stated that they included any study in other languages other than like English, and the authors only included randomized controlled trials and excluded any other kinds of studies. Was the list of studies, inclusion and exclusion, provided? Only the inclusion was provided, but all 30 randomized control trials were included within the systematic review itself. Were the characteristics of the individual studies provided? Yes, there was a table with all 30 randomized control trials that were involved with the systematic review. And this table included study, participants, interventions, outcomes, results, or side effects, and any notes that were noted. So it did have a good table on that. The scientific quality of the included studies was assessed and documented. Yes. The authors included studies that were randomized control trials into the systematic review. So no case reports, no retroactive studies, anything like that. Was the scientific quality of the included studies appropriate for forming conclusions? I said yes, but the conclusion of the article was that there was no conclusion. There was no clear-cut winner for conservative treatment of what was better and what wasn't. And no, they stated that there was no particular treatment that was more effective. So their conclusion was based off of the results of the randomized control trials. Were the methods used to combine the findings of the study appropriate? I said no on this one. The authors did not run a statistical analysis on the data that was extracted. They just used the statistical analysis that each individual study performed in their publication, but the authors did not run their own statistical analysis. Was the likelihood of publication bias assessed? No, there was no mention or no discussion of the bias within the systematic review, so I said no for this one. And no conflict of interest was stated, so I said no for this criteria as well. So it was hard to tell if there was any conflict of interest going on behind the scenes. And that's it for the AMSTAR. Thanks for watching. I appreciate it.